Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural healthcare headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. Most urgent. This week, our most urgent headline is the new federal oversight from CMS that aims to reduce Medicaid spending on undocumented immigrants. Now, under EMTALA, or the Emergency Medical Treatment and Labor Act, Medicare participating hospitals are required. They're not suggested, they're not requested, but they're required to provide care for every patient who walks through the emergency room doors. And that care is covered under Medicare and Medicaid as appropriate. However, CMS has expressed concern that some states are providing care beyond emergency treatment using Medicaid funding. The new oversight will include evaluations of Medicaid spending reports, review of financial systems, and even evaluation of eligibility. On to the damage report. Let's turn to the GOP bill recently passed by the Energy and Commerce Committee and the House Budget Committee. We have focused primarily on the cuts to Medicaid in our weekly news update, but today, let's look at all the other ways the bill will affect healthcare. Besides Medicaid cuts, the most significant part of the legislation are changes to the ACA, now Affordable Care Act, Medicare, and federal loans for medical students. The ACA coverage will be restricted by this bill, including shorter enrollment windows, reducing financial assistance for enrollees, and much higher deductibles. The ACA's enhanced premium tax credits will also not be renewed under the new policy when they expire at the end of this year. All of these restrictions will push more cost to the payers and hospitals as enrollee rates decline. Medicaid expansion will also be discouraged under this legislation because non-expansion states will receive higher federal payments for the ACA. Let's talk about Medicare for a minute then. If this bill passes and it's currently written today, the Congressional Budget Office projects a $500 billion loss in Medicare funding over the next 10 years. Physician payments under Medicare are expected to increase by adjusting the Medicare Economic Index. We'll see stricter eligibility requirements for enrollees and new allowances for HAS contributors. But the most interesting change to Medicare is the eligibility expansion for rural emergency hospitals. For the last 2 years, rural emergency hospital designation has allowed hospitals to receive additional payments from Medicare. Under the new legislation, Medicare eligibility would be expanded under a look-back period, allowing hospitals that were open from 2014 to 2020, but closed in the last 5 years to reopen as REHs. The goal is to provide more rural communities with access to local emergency care, only emergency care. But unfortunately, we've seen how difficult it is for closed hospitals ever to reopen under any circumstances. In fact, according to a 2023 study by Chartis, only 77 hospitals in the United States were ideal candidates for REH conversion in the first place, while 453 rural hospitals are right now vulnerable to closure. Lastly, the bill will limit federal student loans for medical students by eliminating certain programs and requiring loan caps for graduate and professional programs. As we're already facing a critical shortage of physicians across this nation, these loan restrictions could do further damage to the talent pipeline for our industry. Of course, the cuts to Medicaid remain our primary concern. But let's not ignore these other changes that we'll see enacted by this bill. We expect news from the Senate regarding the future of this legislation within the next few weeks, and you can rest assured we will keep you informed. For today's success story, we want to reflect on the voices that are rising up in opposition to the projected declines in healthcare access by cutting Medicaid. Our team at Hillsdale Hospital has been speaking up through news updates, our online dashboard, social media education, video stories, and more. And in the past few weeks, we've been encouraged to see other healthcare organizations, leaders, and rural communities express their concern with this pending legislation. Letters and articles expressing concern and calling for defense of the program have been published as far as from AARP, the American Cancer Society, Alliance for Aging Research, the Children's Hospital Association, and many more. In Arizona, conversations are happening in the property management space regarding the impact of Medicaid cuts on rural tenants in the housing industry. Stories and reports have emerged from an incredible variety of all fields, including many not even related to healthcare, because cuts to Medicaid will have a far-reaching impact beyond hospital and beyond Medicaid beneficiaries. To learn more about what Hillsdale Hospital is doing to encourage our lawmakers to protect Medicaid, visit hillsdalehospital.com/Medicaid. Thank you to our sources for this episode: Becker's Hospital Review, KFF Health News, Kiplinger, Chartis, and Modern Medicaid Alliance.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.